I'm going to discuss about our clinical work in spinal cord injury rehabilitation with cell therapies. My name is Wenchun Qu. I'm from the Mayo Clinic. I have no conflict of interest to disclose. I'm not going to discuss off-label use of any medications. First, let's have a look at a case. Here's a 53-year-old gentleman who had a spinal cord injury from a surfing accident. He sustained paralysis below the neck. He lost all movements in all four extremities. He has just minimum sensation in the perineum, but not anywhere else in the body and limbs. He was treated with surgery, physical therapy, and occupational therapy. He went through the acute, subacute, and outpatient rehabilitation programs. We know people with spinal cord injury recovers function to a certain extent, and he did regain limited ability. At the time when I evaluated this patient at 7 months after injury, he was able to roll over in bed, and he also recovered functions of sensation in part of the body, but he still had parts of the body and limbs that did not have any sensation. It was noticed that his progress plateaued at 6 months after injury. So we treated the patient with adipose-derived mesenchymal stem cells. The cells were obtained from a piece of adipose tissue from the abdominal wall. It was cultured to 100 million cells in the GMP facility where it is just maintained the super clean environment to avoid contamination. And the cells were injected back into the spinal fluid through lumbar puncture. So that's how we treated the patient. But let's go one step back to look at what happened at the site of the spinal cord injury and think about why we treat with mesenchymal stem cells. In a traumatic spinal cord injury, the damage occurs in 3 phases. During the first phase, blood flow is interrupted, and cells are directly damaged by the injury itself. We know spinal cord is very tender and is protected in the spinal canal, but when the fractures happen, this is what happened immediately. In a subacute phase, the body responds with inflammation and demyelination of the nerve fibers. The nerve fibers do not conduct well without the myelins. So demyelination interrupts the conduction of the nerve fibers so that the signals from the central nervous system above the damage cannot be conducted to the lower part of the body and vice versa. Third, vacuum forms. So those vacuum, that is essentially what eventually becomes the seromyelia, where a hole filled with fluid forms in the spinal cord, which is a structural change. So how mesenchymal stem cells may help? Scientists have found that the mesenchymal stem cells may help the spinal cord injury by protecting the cells, because mesenchymal stem cells produce trophic factors, the growth factors. They encourage tissue sparing, and they produce myelin nearby. Mesenchymal stem cells improves the blood flow by angiogenesis. And with blood flow, there's more oxygen and nutrient going into the damaged area, therefore improve the environment and helps the recovery of the damaged area. This is observed by looking at the blood vessel density, and it was found that the blood vessels, there's more blood vessels at the injured site with mesenchymal stem cells. Mesenchymal stem cells also improves the axon regeneration, and the axon is the center part of the nerve fibers where the conduction of the signal is going through. Very importantly, mesenchymal stem cells has an immunomodulatory function. By suppressing the immune environment, the inflammatory environment, the spinal cord will recover better and the damage is less. So this is accomplished by changing the macrophages from the type 1, which is a pro-inflammatory subtype, to M2, which is a immunoregulatory subtype. Similarly, in T cells, first, it suppresses the inflammatory T cells, but also it encouraged the regulatory T cells where the immune response can be less. And also, mesenchymal stem cells produce anti-inflammatory cytokines. That is very essential for changing the inflammatory environment to a less inflamed environment. Based on this series and scientific findings, Mayo Clinic has tried to do clinical trials to translate those findings into clinical care. We conducted clinical trials of autologous adipose-derived mesenchymal stem cells in the treatment of paralysis due to traumatic spinal cord injury. Our trials are approved by FDA for IND, and we conducted a single-dose intrathecal injection of 100 million autologous culture-expanded adipose-derived mesenchymal cells into the spinal fluid, just as I have described. So we finished the phase 1 study where we recruited 10 patients, and we selected patients who are adults, 18 years and older. They had sustained a blunt traumatic spinal cord injury, just as I have described in a prior slide. The patients are between 2 weeks to 1 year following injury. And the spinal cord injury, the severity is at the grade A or B of Asia grading system. So far, we have finished the recruitment of 10 patients, and 9 patients have completed the trial. In the meanwhile, we have started the phase 2 study, and we just actually finished 40 patients of recruitment. In this presentation, I'm going to talk about the phase 1 progress only. Of the 10 patients, the average age is 35 years. There were 8 male and 2 female patients. Most of you can see there's many more male patients than female. The time of the injection in average is about 12 months out from the procedure, from the injury. The AIS grade is 5A and 5B. We have 6 cervical injuries and 4 thoracic injuries. And the last row, the last column, you can see the progress of the patients. Of the 10 patients, 2 patients did not make any progress at all, and both of the 2 patients were Asia A patients, and then the other 8 patients did make progress. So going back to subject 1, that is the 53-year-old gentleman, he had the motor activities of the upper extremities on both sides improved. So Figure A shows the right upper extremity, and figure B is the left upper extremity, and the color is indicating different muscles. And you can see from these pictures that all his muscles that has been evaluated improved. Figure C is the right lower extremity, and figure D is the left lower extremity, and you can see that all the muscles improves in terms of their strength. In terms of sensation, figure A on this side, on the left side, is the state when he was admitted. And figure B is the state 18 months after the injection. So you can see that the green color indicates the locations where there was absolutely no sensation at the time. The blue color indicates altered sensation. And then the brown color is a normal sensation. You can compare and find that there is more sensation that has been normal in larger areas, and there are larger areas of altered sensation, but the absent sensation has been eliminated. So this is the time series where the sensation and the motor has progressed. So this is So this is 2 years after his treatment that he came back, and then for evaluation, his movement has dramatically improved. His sensation has much improved. And this is a public video that has been posted by the ABC, Good Morning America. So what is the limitations of stem cell therapy for spinal cord injury? First, the cell product needs to be consistent for all trials. Second, access needs to be improved through scalable manufacturing so that it's available for everybody and at a lower price. In addition, we need to find out the in vivo mechanism of actions, because right now we have a lot of evidence in a dish, but we don't have a lot of evidence in the human body. Very importantly, all trials of today are small and in early phase. We need more large-sized clinical trials to identify whether or not this therapy is truly effective. So further directions is, first, we need to identify appropriate sources of mesenchymal stem cells. We need to compare between cells derived from bone marrow, adipose tissue, and umbilical cord. We also need to develop engineered mesenchymal stem cells to address the individual needs. But also, we need, again, large-scale clinical trials. Safety is pretty well established today, but the effectiveness needs to be confirmed by large-scale clinical trials. Thank you.